Good afternoon, everyone. Thank you for joining us today. Let me start, as usual, with an update on the COVID statistics. I can report that an additional 4 positive cases were confirmed yesterday, and that represents 0.1% of the people who were newly tested yesterday. And it takes the total number of cases in Scotland to 18,558. A total of 264 patients are currently in hospital with confirmed COVID, and that is 6 fewer than yesterday. A total of 2 people last night were in intensive care with confirmed COVID, and that is the same number as yesterday. And finally, I'm very pleased and indeed very relieved to say that during the last 24 hours, yet again, no deaths were registered of a patient confirmed through a test as having COVID. And that means the total number of deaths under this measurement remains at 2,491. Although we are now reporting fewer deaths on a daily basis, and there have been several days now with no deaths amongst people confirmed through a test, the total that I have just read out there nevertheless reminds us of the impact the virus has had on families right across the country, and I want again to extend my condolences to everyone who is grieving a loved one. And as always, let me record my thanks to our health and care workers for the extraordinary work that you have done and continue to do. I have 3 things I want to briefly update on today. The first relates to a new NHS pharmacy service which is being launched today. It's called NHS Pharmacy First Scotland, and it is available in all community pharmacies across the country. It replaces our minor ailment service, but unlike that service, which was restricted to certain groups, this new service is available to everyone in Scotland. The Scottish Government has worked closely with Community Pharmacy Scotland and health boards in planning and delivering the new service, and I'm very grateful to them for their hard work. As more NHS services start up, we want to ensure that you get the right care in the right place. And in many circumstances, the best place for you to go for care, certainly in the first instance, will be the community pharmacist. Pharmacists can help people with minor conditions such as sore throats, earache and cold sores. They can also help with common clinical conditions such as urinary tract infections, for which prescribed medicine is often required. Now, at this point, and given the nature of what we're dealing with right now, it's important that I stress that you should not go to your pharmacy first if you have any of the symptoms of COVID, a new cough, a high temperature, or a loss of or change in your sense of taste or smell. In these circumstances, you should self-isolate immediately and book a test through the NHS Inform website or by calling 0800 028 2816. But for other minor conditions, the pharmacist or another trained member of the team will be able to give you advice and will provide medicine if recommended. And if they feel that your condition needs investigation or more specialised care, then they will be able to refer you on to your GP or to another NHS service. Pharmacy First Scotland is yet another demonstration, I think, of the importance and value of the work done by pharmacists across the country. Community pharmacies have been open throughout the pandemic so far, and I know that their staff have worked immensely hard during this whole period. The new service being launched today shows their ongoing commitment to the health and well-being of people in their community, and I'm very grateful to all of them for their efforts. The second point I want to raise is again relevant to the resumption of NHS services. Yesterday, I was able to visit the NHS Louisa Jordan facility at the Scottish Events Campus in Glasgow. As you recall, that's the facility, the temporary facility we created in case we needed additional inpatient capacity because of COVID. Thankfully, we haven't needed it for that reason yet, although we are retaining it as a contingency through the winter in case we need that because of the virus in the future, although we hope, of course, that doesn't happen. But over the last few weeks, a pilot project has been underway there while the hospital is not needed for COVID. And through that pilot project, more than 300 patients have received orthopaedic and plastic surgery consultations since the start of July. And because of the success of that pilot, the hospital will now increase the number of patients it welcomes each day, and it will also expand the services that it offers. For example, it will provide x-rays, other medical image scans and dermatology appointments. And by doing so, it will help us to reduce hospital waiting times and improve outcomes for patients. And it will ensure that we are making use of a facility created to help us deal with COVID, but not at this stage required for that. So we are getting some value, and it is contributing to the wider NHS efforts. And I saw yesterday how much work has been involved in preparing the Louisa Jordan for the COVID contingency, but also for these new services that it is going to be offering. And I want to take the opportunity today to thank everybody who has been involved in whatever capacity in that project. The final point I want to make today relates to the hospitality sector. Outdoor hospitality was allowed to reopen 3 weeks ago, and indoor hospitality resumed 2 weeks ago. There's been a lot of hard work by businesses and staff across the country to make their premises safe for visitors. However, although the majority of businesses are following the rules, we do know anecdotally of some instances of guidance being breached, of seating areas perhaps not being cleaned thoroughly between customers, of staff not wearing face coverings, and of contact details for Test and Protect not being taken. The guidance for hospitality is on the Scottish Government website, so businesses do know what to do, and you as customers also know what to expect. And if you are not aware of that, then you can go and read that. And in response to the industry, the Scottish Government and hospitality associations have now produced an updated set of questions and answers responding to questions that businesses have raised. These were widely shared yesterday across industry association networks, and they deal with everything from queuing arrangements for customers to the mitigations which need to be in place to allow for 1 metre distancing. As you've heard me say before, compliance in the hospitality sector has generally been good, and I'm grateful to everyone for that. But ensuring even better cooperation and even better compliance is in the interests of all of us, government, customers, and of course the sector itself. If we do start to see outbreaks linked to the hospitality sector, we would need to take action, and that could include closing premises down again. Nobody wants to see that happen. So I want to send a message to everyone in the sector today that these guidelines aren't just for the first few weeks. They must become the norm, and you cannot allow standards to slip. And to customers, if any venue that you are frequenting or visiting doesn't seem to be taking COVID seriously, for example, if you're not asked for your contact details and if there's not clear guidance in place about physical distancing, then my advice to you is to go somewhere else because all of us, businesses and individuals, have a role to play here in making sure that compliance is high, that standards are high, and that we are not giving this virus the opportunity to spread because standards are slipping. And the importance of not letting standards slip, of continuing to be very vigilant, careful and cautious is the wider message that I want to leave you with today. The progress we've made and continue to make in Scotland is very significant, and it's very welcome, and the statistics that I've shared with you today underline that again. But as you've heard me say many times, that progress, because of the nature of what we're dealing with, an infectious, very infectious virus, that progress remains fragile. And it may seem a bit odd given the current numbers here in Scotland, but I remain highly concerned, possibly increasingly concerned again about the COVID risk. We are currently seeing a worrying resurgence of COVID cases, not just in faraway parts of the world, but also in several countries across Europe right now. For example, parts of Spain and Belgium have seen increases in COVID in the last couple of weeks, and we're seeing outbreaks in countries like Germany and France. And I think there are two important lessons for us from that. The most immediate one is that as the prevalence of COVID in Scotland continues to fall, we must guard against the risk of cases coming into the country from outside. So if necessary, the Scottish Government will reimpose quarantine restrictions on travel from certain countries, as we did at the weekend for Spain, if those countries see a sharp increase in cases. So people planning overseas holidays need to be aware of that. You cannot assume, and you heard me say this last week, you cannot assume that the rules and regulations applying to or in your destination when you book a holiday will stay the same while you are there or be the same when you come to travel home. And again, as I've said before, but I want to reiterate this point very strongly today, my advice to you remains to be very cautious about non-essential foreign travel at this time. And if you are in a position to have a holiday and want to take a holiday, the safest way of doing so is to stay here in Scotland. So you avoid the risks of foreign travel, but you are also, as an added bonus, helping the Scottish tourist industry as well. There is, though, a wider lesson from the rise in cases that we're seeing in other countries. COVID is currently declining in Scotland, but it is not declining around the world. The WHO is very clear that globally this pandemic is still accelerating. And several countries which had seen falls in their COVID rates, as we are seeing and have been seeing here in Scotland, are now dealing with new cases again and rising incidents. And the point I want to make again today is that the same thing could easily happen in Scotland. And it will happen if we drop our guard. So all of us must continue to be careful. For the government, that means we must continue to take steps to guard against a surge in cases, and sometimes that will involve us taking unpopular and difficult decisions, but we will not shy away from that if that is necessary to help protect the country. And it's one reason why, when we announce our review of the remaining COVID restrictions on Thursday, we are likely to adopt a very cautious approach at this stage. And for all of us, it's vital that we continue to do everything we possibly can to stay safe. As we meet more people, support local businesses, we need to think about whether we are acting in a way that could be allowing the virus to spread. And that's why I want to end, as I always do, by highlighting facts. These are the 5 steps which will help to keep you safe, even as you go out and about more. And please don't see these as optional. Please see these steps as an essential part of life right now and for the foreseeable future. See them as steps that are just as important to your well-being and safety as wearing a seatbelt or looking both ways before you cross the road. And in this situation, remember that failure to comply doesn't just put your health at risk, it puts other people's health at risk as well. So remember the 5 golden rules. Face coverings must be worn in shops and public transport, but you should wear a face covering in any enclosed spaces. Avoid crowded places, indoors and outdoors. Clean your hands and clean hard surfaces regularly. 2-metre distancing remains our very clear advice. And self-isolate and book a test if you have symptoms, and you can go onto the NHS Inform website to find out more about that. If we all remember these 5 basic measures, then all of us will be playing our part in minimising the opportunities for COVID to spread, and we will therefore be helping in keeping this virus under control. And that will help protect ourselves, it will help protect others, and it will protect the NHS and help us all to save lives. So thank you once again to everybody who's doing the right thing. I know it feels as if we have been living with this now for a very long time, because we have. It has been difficult, it has been painful, it will continue to be so, but we cannot drop our guard, because the risk of COVID has not gone away. It is still out there, and we all must play our part in continuing to help to tackle and to mitigate it. Thank you very much for listening. I'm going to hand over to the Deputy First Minister to say a few words, and then to the Deputy Chief Medical Officer before we take questions as normal. John.
Okay, thank you, First Minister. The Education Recovery Group reached agreement last week on the guidance that can enable schools to reopen safely on a full-time basis from the 11th of August. I'm grateful for the hard work and collaborative approach of all of our partners in this task, in local government, the unions and the professional associations, and amongst parents. The Education Recovery Group has received and considered multiple pieces of scientific advice from the COVID-19 Advisory Subgroup on Education and Children's Issues. That advice has helped us to develop guidance for local authorities and schools, which clearly sets out the approach that must be taken, subject to risk mitigation measures, to allow pupils to return safely to both primary and secondary schools on a full-time basis, without reducing capacity within that school. The endeavours of everyone in Scotland to follow facts, as the First Minister has just set out, and take steps to suppress coronavirus means that I believe at this point we should be confident that our schools can reopen safely and our children can return to learning with their peers and teachers in school. A final decision will be taken by the Cabinet tomorrow and set out to Parliament by the First Minister on Thursday, as part of our statutory 3-weekly review process, at which point we will also publish the guidance to which I have referred. As we consider the reopening of schools, it is vital that, along with our partners, we address the wider impacts of the virus on the health, well-being and educational attainment of children and young people, to whom we have listened carefully about their aspirations about the return to schooling. It is important to recognise at this moment that the well-being of children and young people as they reconnect with learning is critical and needs careful planning. Schools and local authorities also recognise this, and I can assure parents that they are working hard to develop plans for children and young people to return to school. I know how important it is for parents to feel reassured that schools will be safe for their children, as well as places to learn and to flourish. You need to know the type and level of support schools will be able to offer your children in the new term. In preparation for this, the Scottish Government has provided local authorities with funding of £50 million to help them recruit more teachers and support staff. This will bolster support for children and young people as they return to face-to-face education, mitigate for learning loss due to the impact of COVID-19, and support closing the attainment gap. It will also provide much needed resilience to our education system as we work to recover from COVID-19 and to support staff in the delivery of the important work that they carry out within our schools. In addition, I've made £20 million immediately available to local authorities to support the logistical reopening of schools, for example, improvements in cleaning regimes and the procurement of PPE that is required. It is to be expected that some children and young people may have new needs as a result of the COVID-19 pandemic. Therefore, specific advice for parents and carers, including to support children and young people with additional support needs, has been published on the Parent Club's Coronavirus Hub. The Education Recovery Group's guidance on the recovery curriculum advises that schools should prioritise well-being when schools reopen. I want to be clear that this will be a big change for everyone. Throughout this crisis, an important focus has been on supporting those children and young people who rely on schools, early learning and childcare, those individuals for whom these places offer a place of safety and stability that they would otherwise be lacking. I've previously recognised the importance of learning hubs on so many levels for vulnerable children where meeting their needs continues to make a crucial difference. Having witnessed at close hand the endeavours of colleagues across the education sector in recent months, I'm confident that together we will be in a very strong position to support our children and young people to return safely to school at the beginning of term next month. This is all part of the work to achieve our shared vision for education in Scotland, which is to achieve excellence and equity for all of our children and young people. It is a moral and educational imperative to support our children and young people back into school as soon as we know it is safe to do so. I know that our partners in local government are as committed as we are to have our children back at school, and I look forward to making that a reality for Scotland's children and young people as early as we can in August.
Thanks, Ron. And finally, Dr. Steedman.
Thank you. So today I'd like to talk to you all a little bit about turning science into action. So to begin with, I want to share with you some promising news in terms of a potential vaccine against coronavirus, which I know many people want to know more about. Now, some of you will have seen just last week the latest results from the Oxford vaccine studies, which were published in The Lancet. And the way the Oxford vaccine actually works is that if someone is vaccinated, their body recognises the bits of coronavirus in the vaccine as foreign and makes an immune response to those bits of coronavirus. And the important thing is that then the body remembers this immune response so that if the real coronavirus then comes along to infect the person, their immune response recognises it much faster, having seen bits of it before, and can hopefully prevent the virus from then infecting someone or causing disease. So the research article last week reported on the results of more than 500 people who've been given this candidate vaccine as part of a research trial. And the results? Well, firstly and crucially, the vaccine appeared safe with no serious side effects which were seen in the trial. But secondly, in those people where their immune response was able to be measured, all of them showed a good response in terms of both parts of the immune system that we know are important in fighting viruses. So that's both the cells and the antibodies. Now, in terms of the science, there's obviously more. In fact, there's much more to be done with larger numbers of people to be tested with the vaccine. And we need to know how well it works in the real world in terms of whether it definitely protects as many people as possible from coronavirus. So it's still early days, but it's definitely good news. Now, research has always been a vital part of our NHS and how we provide the best possible care for all of the people in Scotland. But science and research have never been more important to all of us than now. And recently, I'm really proud to say that our research community in Scotland has supported over 60 COVID studies involving over 6,700 people, and this includes the Oxford vaccine work. And this has led to advances in our understanding of the virus, but also success in identifying treatment options. And this research work in Scotland is testament to the world-class research we have here and the willingness of many of us as patients and as members of the public to support that vital research. But more action is always needed. And with larger scale trials required to support vaccine research and development, a new NHS COVID-19 vaccine research registry has launched across the 4 UK nations. Crucially, what this registry does is it allows those who are interested in volunteering for COVID vaccine trials to register that interest online and to give their permission to be contacted by research teams who are conducting the trials. The online sign-up is available on the website at www.nhs.uk/research contact. Please do visit the online site if you can and think about whether you, like so many others, can volunteer to help with vaccine trials. This important COVID-19 research will obviously continue, but we are also now in Scotland working to restore all of the other vital health research studies that Scotland offered before the pandemic. So I want to finish by expressing my thanks to the research community across Scotland for their sustained and absolutely sterling efforts. And I also want to thank you, the members of the public, patients, including my patients and their families, for your participation in these research studies. COVID-19 has demonstrated the vital importance of research in terms of our health. And remember that many of us have our own part to play in helping to turn this science into action. Thank you.
Many thanks. You've heard us talk before about how we've all got a part to play in tackling this virus, and that's very true. Dr. Steedman has just given another possible way in which not all of us, but some of us will be able to help this time in development of a vaccine. So if you are interested in registering your details to see whether you could volunteer to take part in a vaccine trial, then please go to the website that Dr. Steedman has just read out. If you didn't get the chance to take it down, I will tweet it from my Twitter account this afternoon so that you have that available. But we need people to volunteer so that the work to develop a vaccine can continue apace and hopefully reach a successful conclusion soon. We'll move to questions now. Can I start with Katrina Renton from BBC Scotland?
Good afternoon, First Minister. The infectious disease scientist Professor Babak Javid has told BBC Disclosure that he does not understand why the Scottish Government waited until June to make mask wearing in care homes mandatory. He says the evidence of asymptomatic transmission was there in March. Did the Scottish Government wait too long?
Thanks for your question, Katrina. I understand the disclosure programme that you refer to airs tonight, so I've not had the opportunity to see it. I've seen some reporting of it, but I will wait and get the opportunity to see it before I comment in detail. I've stood here at this podium and rightly answered questions on a whole range of issues to do with the management of COVID within care homes. In terms of the provision of PPE to staff, you've heard us at an earlier stage talk about that in relation to care home staff and health staff. Obviously, visiting has been very restricted in care homes, so those coming into care homes from outside has been under extreme constraint and is now slowly starting to move forward again. You've also heard me talking about issues around testing and and the infection control and risk assessments that were done in terms of people being admitted to care homes. So I'm happy to respond and give more detail should it be required. But if you don't mind, I'm going to wait to actually see the programme before responding to things that I've not actually seen in full. So if you want to ask me again tomorrow, I'll probably be in a better position to give you an answer. Louise Scott, from STV.
Thank you, First Minister. Are you able to give us an update on how enforcement is going for those returning from countries where quarantine is required? How frequent are the checks being made? And how many fines have actually been issued to those flouting quarantine? And can I also just ask about Gibraltar? It is on the exempt list. Is there concerns travellers could be visiting mainland Spain from Gibraltar? Is it likely this could be reviewed?
I will provide you with the up-to-date statistics later on. I don't have the statistics in front of me, but as you know, because again, we've gone through this on previous occasions here, there is a process now underway where people who have come into the country there are checks done and a percentage of people are contacted so that we have an understanding of compliance. All of the information I have is that we believe compliance is high. I think that is true UK-wide, but obviously I'm concerned with Scotland, but we will see about getting you the up-to-date statistics on that later on. In terms of the point about trying to circumvent regulations by going through different countries, again, I don't have the regulations in front of me, so I'm not actually quoting here, but the regulations are drawn in such a way that if you come into this country from a country, even if it's not your starting point, but if you come in from a country that is on the quarantine list, then you have to quarantine. And domestically within the UK, although we have an aligned position right now across the 4 countries, you've heard me say before, if you come to Scotland but come via an airport in England, the regulations, if you're coming to Scotland that are in place in Scotland, apply. So you can't circumvent these regulations by taking circuitous journeys. That's a general point, not a specific point around Gibraltar. I think the only other point I would want to make on this is to underline and reiterate the point I made in my opening remarks. Last week, in fact, I think probably exactly this time last week, we were talking about Spain, which at that point we had decided to put on the exempt list for quarantine, and I was explaining some of the reasons behind that. But I made the point then, which I'm going to make again, and this doesn't simply relate to Spain, it is a general point that relates to every country across the world and will relate to the UK in terms of the considerations other countries are made. These things are not set in stone. We are dealing with a virus that is unfortunately unpredictable, that can change very quickly in terms of going from a position where it looks as if it's under control to rising again very, very quickly. And therefore, if you're booking foreign travel right now, just because as you book that travel, a country looks to be exempt from quarantine when you come home, do not assume that that will not change. As we saw with Spain last week, it might change at very, very short notice. And you also can't be sure that the country you're going to won't change its own internal regulations while you're there if it has a spike in cases. All of that leads me to pretty much advise to be very, very cautious about non-essential foreign travel right now, because it is very unpredictable. And I know that is really frustrating for people who want to go on holiday after a very difficult few months, but you cannot be certain that the situation doesn't change while you're away. So that is why I continue to urge that degree of caution. Tom Sheldrick from ITV Border.
Thank you, First Minister. On lockdown reopening, please can I relay a question to you from Michelle Douglas. She's the owner of Impulsive Dance Studio in Kelso. She says, from the dance and performance sector in Scotland, we would like to know when we should get guidance on when and how to open our studios safely for children and young people across the country. What's your response to that, please? As
soon as we are in a position to do that, we will do that, and that will involve any, that's my answer to any sector that has not yet been given the go-ahead to reopen. We know that these sectors want indicative dates and guidance around the safety measures that they were required to put in place. We will do all of that as quickly as possible, but we are in a phase right now, and I've said this on several occasions, where we have made a lot of changes in the last few weeks. We don't yet have the certainty about the impact of those changes in our domestic incidence and prevalence. We also see a situation internationally where the virus is on the rise again in many parts of the world. And we have very clear objectives for the next few weeks. We obviously want to see those who've been shielded get to live their lives more normally again. And that central objective of getting schools back full time, these are the absolute priorities. And therefore that does mean that we will take a very cautious approach to any further opening up right now. And I know that is really difficult for people who are in the sectors that can open right now, and we will try to give certainty as soon as we can and as much certainty as we can, but we cannot do everything all at once, or we will very quickly compromise our ability to do the things that I think most people accept are the priorities, which is to get young people back to school. Alan Smith from Bauer.
Thank you, First Minister. On the issue of quarantine, Radio Clyde has spoken with a Glasgow taxi driver who only arrived in Mallorca on Saturday night, and you only decided to travel once the quarantine restrictions had been lifted, but now you face not being able to work for 2 weeks when he comes home, and he says that will lead to substantial loss of earnings. There have been calls for perhaps some sort of compensation scheme to be put in place for people who've been put in that situation. Is this something being considered at all?
It's not something that I want to give people an expectation around. I usually say, and will continue to say, we consider all suggestions that are made to us, but I don't want to raise people's expectations. I know this is really tough. These decisions are not easy, and I know the people who bear the consequences of these decisions find it really difficult as well. And you know, contextually, as I said just a few moments ago, there is an inherent uncertainty in everything we're dealing with right now, and an inherent unpredictability, because we're dealing with a virus that unfortunately doesn't do what we always tell it or would like to tell it to do. And the situation with the virus here and overseas can change very quickly. We try, and you know, the last question relates to this. We know that the lockdown and all the restrictions that are in place have a big economic impact. So we try to ease them up when and to the greatest extent we can to try to balance out these harms. But all of this is subject to change. And, you know, we last week, because the most up-to-date data that we had on Spain showed that its prevalence was closer to Scotland, we thought, given the impact of these decisions on the aviation and tourist sector, then we could make a move on Spain. But the data that we then saw at the weekend showed that there had been a doubling of cases in the most recent week. So unfortunately, that's the basis on which we have to take these decisions. And that's why last week, standing here, I think probably this very day last week, I was very clear to people that notwithstanding what the regulations say at one point or another on different countries and whether they're in the quarantine list or out of it, you cannot assume that will not change at very short notice. And unfortunately, that has been borne out by the situation in Spain. But that's why I said that. You cannot assume that because a country is in one list when you book a holiday and go there, that it will be on that list when you come home. And that is why I continue to say to people, and I take no pleasure in saying this because of the impact on individuals and the impact on industries that are very important to Scotland. But right now, be very, very cautious about booking foreign travel that is not essential, because you don't know that when you're in a country, they may change their regulations, and so you might find yourself restricted in that country, and then when you go to come home, you might find that the quarantine rules have changed here. Unfortunately, that's the nature of what we're dealing with right now. So I want to be really blunt and really clear with people that, you know, I wouldn't, if you're asking me, I wouldn't be booking a foreign holiday right now because of these reasons. I'd be choosing, if I had the time to go on holiday, I'd be choosing to spend it here in Scotland. Fraser Knight from Global.
Minister, just picking up on that point that you've made to Alan there, you've said that countries on the exemption list are under constant review. And while you do stress caution for people booking holidays abroad, there are people undoubtedly out there still looking for last-minute getaways, and they do want to get away. So can you tell us some of the other countries that are under kind of close review at the moment? You've said at the start of this that, you know, some of them were amber or red countries. Are some of the amber countries, can you tell us some of them that people might be best to avoid booking at the moment just now?
Well, I'll try to answer that I'll try to be even clearer than I was in my answer to Alan here. I can't give you, all countries are under review. There are countries that a couple of weeks ago I would not have expected to be seeing a resurgence in cases, but we are right now. And there'll be countries right now that look as if possibly, although I fervently hope not, even our own could be in this position where things look really stable and low level right now, that a week or so from now might look very different. That's in the nature of a virus. And I know I'm making an obvious point here, and I don't want to sound as if I'm sort of being oversimplistic about this, but this is an infectious virus. It doesn't obey orders of governments. It behaves in the way it wants to behave, and it takes advantage of the things we do to allow it the opportunities to spread. So it is uncertain, and any country could change at very short notice. And I cannot, so if I was to say right now, here's a list of countries that it might be okay to go to, I'd be misleading people potentially, because I don't know that tomorrow or next week that would still be the case. So my advice to anybody, and I know how badly at this time of year people want to get away for a break and a last minute deal to get some sunshine. I totally understand that. But right now, I can't, you are all responsible adults and you will make your own decisions about this. All I can do as First Minister is give you the best advice I can. And right now, I would be very, very cautious about foreign travel that is not essential. And I can tell you, not as First Minister, but as a citizen, right now, I wouldn't decide to go away on a foreign holiday because of the inherent uncertainty in everything that we're dealing with right now. And, people can choose to take that advice or not take that advice, but I don't want you to be able to come back at me and say, I didn't give you that advice pretty clearly. So it's about the third time I've done it today, and I'll probably do it a few more times as well. Nicola, do you want to say anything about just the inherent uncertainty in what we're dealing with?
I think the first thing to say is that we all appreciate how very difficult the situation is. We are all in this together, and we are doing the best that we can to provide the most up-to-date information on all the countries in order to be able to protect the health of the people of Scotland. And because everything can change so very rapidly with this virus, that means that nowhere is completely safe. It's a global pandemic. And I think we run the risk of thinking, because lots of things have been opened up and our case numbers thankfully remain low for the current time in Scotland, that the virus has gone away. It hasn't. It is a global pandemic. And we need to be so careful at the moment, because in a few weeks' time, we don't want to be in the same position as some of these other countries where rates of transmission have been low and then have shot up. It's a highly infectious virus. And we know, certainly within Scotland, as I've spoken about before, but elsewhere in the world, an enormous number of people have not yet been exposed to this virus. So the risk is still there, the risk is real, which is why these measures are so important. And we wouldn't put them in place if we didn't think it was necessary to protect the health of the public. And I would love, as would the First Minister, to be able to give you a list of places and carte blanche to be able to go to them. But I wouldn't do that for members of my family, and I wouldn't do it for any of the other people in Scotland either. We can only tell you the truth, however hard that is and however unpopular it might make us.
Katrine Bussey from PE. Katrine, are you there?
I am sorry, I'm having internet difficulties today. But I have a couple of questions regarding the reopening of schools, which perhaps might be better suited to the Deputy First Minister. I wondered, first of all, quite simply, if a decision about the reopening of schools is being taken on Wednesday by the Cabinet, why is it not being announced on Wednesday? Because after all, parents and children across Scotland have been waiting a very long time to find out what's happening with schools and the return to education. And I also wanted to ask about the return date of August 11th. Usually councils across the country will set their own date for schools returning. And in some cases, this will mean that teachers and children are missing out on holiday entitlement. will these authorities where, schools are going back earlier than had been planned be able to retake those holidays at a later stage?
Thanks for the two questions, Katrine. On the first point, this is a very significant decision, and Parliament has been very clear with the government, rightly in my view, that significant decisions about coronavirus should be announced to members of Parliament, and that's exactly what will happen on Thursday when the First Minister gives the 3-weekly update on the progress in relation to the route map out of the coronavirus lockdown. That news will be conveyed to Parliament. So it's an important element of our accountability as a government to the democratically elected members of Parliament that Parliament will be told on Thursday of the conclusions the Cabinet has arrived at. And I appreciate that parents are looking for certainty. What I've been trying to do, and this is a careful piece of work that's had to be done, is I've had to make sure that we're able to reassure all of the different stakeholders that are important in our education system, whether that's pupils, staff, parents, local authorities, to work together to make sure that we come to the right decision. And that will be discussed and agreed at Cabinet tomorrow and conveyed to Parliament on Thursday. On the second point about the return date of the 11th of August, you're correct. There's a number of authorities are coming back earlier as a consequence of the arrangements that we've put in place. We've made clear through the SNCT machinery that there should be compensatory days taken at other stages during the school year for the fact that some authorities are coming back early, and those local negotiations will take their course. And one of the important points about the start back to schooling, which is envisaged in the guidance, is that we've got to take care to make sure that's done safely. So some local authorities, within reasonable limits, will undertake that on a phased basis to make sure we can have a safe reopening of schools if the strategic decision is put in place to enable that to happen.
Thanks. Christine Lavelle from The Sun.
Thank you, First Minister. My question's also on schools for Mr Swinney. You indicated yesterday that surveillance testing will be carried out in some schools rather than routine testing in all schools. Given that we've seen routine testing in likes of football clubs pick up a cluster of cases in recent days, would it not be useful for teachers and older pupils to be routinely checked?
Surveillance testing is one element of the testing arrangements that will be in place. We have, of course, the capacity to deliver the Test and Protect system, which is available to all individuals in the country when they have any symptoms of the virus. So any individual in a school context has access to Test and Protect. But we're putting an extra layer of testing on top of that, which is surveillance testing, which will be extensive across a broad range of schools within Scotland to make sure that we can pick up any intelligence about the spread of the virus and can reflect that in the local planning that we take forward. So it's an extra level of assurance that we are putting into the system to enable us to be able to reassure parents and staff and pupils about the safety of being in the education system and about what measures can be taken to address that should there be any examples of prevalence of coronavirus that come to light.
Gina Davison from The Scotsman.
First Minister, Michael Gove was in Scotland yesterday, as you'll know, and he mentioned that the Scottish Government was involved in putting out some kind of shared statement with the UK Government about how you were going to be tackling the COVID crisis from here on in, and I just wondered if you could give us any more information on that. And could I also ask a question of the Deputy First Minister regarding schools? A new scientific report came out showing that in Israel, 10 days after schools were reopened, there was a major outbreak of coronavirus in a high school. Now, none of the kids were wearing masks or the staff, and yet it turned out that 153 students and 25 staff members were all COVID positive. And I just wonder if that kind of science is being fed into your decisions around this, and if masks might become something that you'll expect secondary school pupils to have to wear.
I'll hand over to John in a second on the schools question. On the question about a possible joint statement between the four nations, there is some work underway to explore whether or not that's possible. It was that comes from a suggestion I made at a Four Nations discussion on Friday last week, I think. To be frank, my objective there was to see if we can get to a point where we align the Four Nations around a strategy that is effectively about trying to eliminate the virus. Now, people have different views about the word elimination, and so, you know, let's put that to one side at the moment. What we have sought to look at is whether we can come to a joint approach that makes very clear that we are all trying to drive this virus to the lowest possible level, which I would call effective elimination, and keep it there, as opposed to having an approach that allows the virus to hover around at a certain level and then hope it doesn't overwhelm you. So there's some work being undertaken. I was pleased to hear Michael Gove be positive about that when he was talking to the media. So if we can come to a Four Nations agreement, then we will no doubt publish that statement, and I will update if we get to that point. But each of the other three administrations obviously will want to think about that and to consider any drafts as well. So at this stage I can't speak for any of them, but given the geography of the UK, if we could all align around an approach that is very explicitly about driving this virus to the lowest possible level and allow our policy decisions to flow from that, then I think that would be a good step forward. John.
Thanks, First Minister. One of the key points that the expert advisory group has stressed to us is that they will constantly look at emerging evidence around the development of COVID. This is still a relatively early virus for us to understand. So they are constantly looking at other international studies, and the advice that they have given us is their best reflection of the issues that have become apparent so far, although they reserve the right to come back to us and say that some of that advice may change as other evidence emerges. So the Israel study to which you referred, Gina, has been considered by our expert advisory group. Their assessment of that is that the Israeli experience is significantly influenced by wider community transmission issues, which of course is one of the reasons why we feel more confident about being able to reopen schools, because community transmission has been suppressed to such a significant extent within Scotland. But there will be an importance of looking at all emerging evidence from other countries. And one of the points I made to the Education Committee yesterday is that it may well be conceivable that some of the guidance that we publish later on this week may have to change at some stage in the future if the evidence to which we have access changes as well. And obviously we will explain clearly to people the circumstances in which that might be necessary if it in fact happens to be so.
Michael Blackley from the Daily Mail.
Thank you, First Minister. Given the experience of some of the other European countries that you've discussed today, how big a risk do you think it is that there will be a second wave of this virus in Scotland and across the UK? How big a risk is it that it could be in winter when the NHS will already be battling against the traditional flu season? What are you doing to prepare for that? Will there be extended eligibility, for example, for the flu vaccine, and are the supplies there for that?
Okay, there's a few different aspects to that. I'll have a go at answering them, and then Dr. Steedman probably will want to add a few things. You started off by asking me if certain things were at risk. All of these things are big risks right now. So a resurgence of effectively the first wave of this is a risk, and I think we are possibly seeing that in some parts of Europe and the wider world right now. And so too, as we go into the autumn-winter months, so too is the prospect of a second wave. Now, people more expert than me will would have to look at any particular resurgence of the virus and give you a more specialist opinion as to whether it's a continuation of the first wave or a second wave. But what we are undoubtedly seeing right now, and I think what we will continue to face as a risk, is a resurgence of the virus. And that means we must continue to be very, very careful and cautious and try to protect ourselves against that as much as possible. And that means doing as much as we can, and there will always be limitations to everything I'm about to talk about here, but doing as much as we can to mitigate against the risk of importation. The risk of importing cases of this virus into the country right now is probably higher than it's been at any time since the start of lockdown, for obvious reasons, as we open things up again. So it depends on that. It depends on all of us continuing to follow the golden rules of the facts advice so that we are minimising the opportunities for the virus to spread. And it means government has to be very vigilant and be prepared to act if we see locally or nationally the situation look as if it might run out of control again. So this is going to continue to be really difficult over the months to come. And as I say, you can debate whether that is going to be continuation of the first wave or a second wave. As we go into winter, though, we have the added challenge, if I can call it that, because it undoubtedly is, of concurrent risks. So we could, as well as having a resurgence of COVID or a second wave of COVID, we could also have a lot of flu. And that has some practical issues because lots more people will be waking up in the morning with symptoms of what we will be telling them necessitates a COVID test. But unlike right now, where there's less of these illnesses going around in winter, that might be flu, it might be COVID, it might be one of the many other respiratory things that we all suffer from in winter. So that's going to add a significant layer of challenge. The flu vaccine is an important part of the work we will do in coming months, and we will set out in the very near future the eligibility groups, which are likely to be wider than normal this year for the flu vaccine. And my last point before I hand over to Nicola is that we, and I think I've said this before, Sir Harry Burns, the former Chief Medical Officer, is convening a subgroup of our advisory group right now, looking specifically at these concurrent risks that we will face in winter and what steps we need to take to try to prepare for them. But, I don't stand here every day, saying all of this just to depress people. There's lots for us to be positive about in the situation that we have got ourselves into in Scotland. But the next few months are going to be challenging, just as the last few months have been challenging, because this virus is out there and it hasn't gone away, and it is unlikely simply to disappear of its own accord. Of course, we have hopes for vaccine and treatments, but until we know that they are going to materialise, we have to remain absolutely focused on everything we need to do to keep this risk and all of the other risks that will come with it under control. Nicola.
When people ask about a second wave of COVID, I think they're asking, is COVID still a threat? And the very clear answer to that is absolutely yes. The prevalence in Scotland has certainly and very gratifyingly decreased since we brought in all of the things that we've recommended along the way and are now really well encapsulated in our advice on facts. But we still have no universal treatment. We still don't have a vaccine that is available for the population. And we think that only 5% of people in Scotland have been exposed to the virus. Although the cases that we're seeing at the moment are being controlled, those levels are being controlled, it doesn't reflect the most recent changes yet that we have made in terms of easing restrictions. And that, coupled with winter, when we know the virus likes low temperatures, and we know that people will be indoors more, where the virus lives for longer, we would be extremely foolish not to be very cautious going into winter and not to be complacent about the measures that we've put in place so far. We aren't out of the woods yet. The Public Health Threats Advisory Group, which is the subgroup that the First Minister has mentioned, have been set up specifically for that purpose, to anticipate that there could be a second wave and to attempt to put in place in advance everything that we can do to prevent that. So we are being as prepared as we possibly can. In terms of flu, then of course that is an additional factor to consider coming into the winter. And we have established a flu and coronavirus programme board for Scotland, which is looking specifically at vaccination of the population with the available flu vaccine that we will have this year, but also if a COVID vaccine does become available. So again, we are going to be prepared as we can be. And I would urge, as I've done before, that all those people who are currently eligible for flu vaccine and who will be called over the next few months, particularly the elderly and health and social care workers, who I'll make a personal plea to as a health and social care worker myself, as well as those people with at-risk comorbidities and pregnant women, please do take up the flu vaccine this year. Our priority this year is to base flu vaccination on those most at risk, and that will always be our way of using flu vaccine. We will, of course, obtain as much as we possibly can. We will use that as wisely as we can, and we will extend eligibility if we are able to do so based on the amount of vaccine that we can get and based on clinical and scientific advice in terms of the risk specifically to certain populations. So it's all done on a clinical basis for those who are most at need. So I think the bottom line is we have reasons to be positive, but we do not have reasons to be complacent.
Absolutely. I would echo that strongly. Simon Johnson from The Telegraph.
Good afternoon, First Minister. I appreciate what you said, I think, to Fraser earlier, that you can't anticipate which country might be next back on the quarantine list because the situation is too unpredictable. But you did mention in your opening remarks France, Germany and Belgium, and I just wondered if you had particular concerns about what we're seeing there.
No, so I'm going to, I suppose, give the same answer in the other direction. Just because I mention a country that you can Google and go onto any news website today and find what I've said, that there are parts of a couple of Länder in Germany, there's part of France that is seeing outbreaks. That doesn't mean that I am signalling today that we're about to put Germany and France back on the quarantine list, but nor can I rule that out because I can't rule it out for any country. So it all just underlines that central point I'm making, that this is not something that is possible. And I would love nothing more to be able to stand up here and give certainty and predictability in these things. Trust me, it would make my life and our lives a lot easier as well, and it would make your lives much easier, but it's just not in the nature of what we're dealing with right now. So the important thing for me then to do is to be certain with people about the uncertainty and to give as much advice as I can so that you are factoring in that uncertainty to the decisions you're making. And if you decide to go overseas, then that is up to you. You can do that, but I don't want you doing that without being clear about the risks you will be taking when you do. And that's, I think it's about as certain as I can be in an inherently uncertain situation. Tom Martin from The Express.
Hi, good afternoon, First Minister. Reports today have suggested UK ministers are looking at reducing the quarantine period to 10 days. It's been suggested somebody could come back and be tested after 8 days. If they're clear, they could come out of quarantine 2 days later, thereby cutting it down by 4 days. I just wondered, is that something you're looking into yourself? And secondly, if I may, Saturday's decision, the Justice Secretary said, was made clear yesterday, was taken on a 4 nations basis. I just wondered, are we now going to see greater alignment on the quarantine issue back on a 4 nations basis?
On that point, I think as you've heard me say a lot throughout this pandemic, where we can operate on a 4 nations basis, it makes sense to do so. The conditions for that are that it does make genuine sense, that the conditions we're dealing with are aligned enough across the 4 nations that the same response is appropriate across the 4 nations, and that will not always be the case. The second condition is that we agree on what we should do, and where both of those conditions are met, then 4 nations cooperation has happened and should continue to happen. There will be occasions where either because the situation in one of or more of the nations is different, we reach different views, and that's happened on a range of things in Scotland. And I think you get from my demeanour today, I am not complacent, but I think the approach we've been taking in Scotland based on where we are right now is being effective. So there'll be times where the situations are different. There'll be other times where we just have perhaps a disagreement on the right thing to do, which is perfectly legitimate between different governments. But where 4 nations approaches can work, we will always try to take them. And on the point about testing as an alternative to quarantine or a partial alternative to quarantine, I've read the the reports that you've referred to in the media. We know that there are often considerations like this underway. Nicola might want to say a word or two about this as well. When we first announced the quarantine, I think the first round of decisions we took about exempt countries, I think I stood here and said that we were going to explore whether there could be alternatives to quarantine. So we remain open-minded to that. But I think it's also really important to understand that these things are not straightforward. So I said earlier on, the risk of importing COVID to Scotland right now is higher than it's been since the start of lockdown for obvious reasons. And as we consider these things, what we have to do is decide if you were to have a situation where somebody was tested on arrival and then a few days later, and if they're negative in both, they get released from quarantine, you have to work out whether that is going to be as effective at capturing cases as 14-day quarantine would be, and what the balance of risk would be. Would you be risking more cases slipping through the net with the testing approach than you would be with the blanket quarantine? And these are not easy judgments, but they are judgments that you have to make quite carefully. What we do know is the incubation period of this virus makes it difficult to be categoric that because somebody has a negative test on one day, that they are actually negative and would test negative a day or 2 days later because of the incubation period. So certainly simply testing people on arrival and then saying if you're negative you don't have to quarantine, that would be a big risk. Whether there are other options, we look at these things on an ongoing basis, but we do take quite a risk-averse approach for all the reasons that I think everybody understands given the nature of what we're dealing with. Nicola, do you want to add to that?
Thank you. I think we would all love to not have to recommend that people isolate, whether they're contacts of COVID or whether they're coming in from countries where COVID is more prevalent than in Scotland. It's not an easy thing to have to do. It is not something that we enjoy having to recommend. And I'll say again that we recommend these things for the best possible clinical and public health reasons, that we're trying to protect the people of Scotland. The First Minister is absolutely right. All the science so far suggests that the incubation period of COVID is up to 14 days. And that means that anyone who's been exposed to COVID can, in theory, take up to 14 days to show symptoms of the virus or to begin to shed the virus. So you can see that this makes it very difficult to easily put in place a strategy whereby you could say to someone, yes, it's fine for you to be released from isolation earlier than that. We will always look at whatever means are available to make the situation as easy for people to comply with. We don't want to put in place restrictions that are not necessary, but we absolutely have to look at the consequences of any of these suggested changes in the isolation period. The First Minister, again, is, of course, absolutely right. You can't just test someone at day 0 when they arrive in a country. If you were to put in a testing regimen, you would probably have to test them at least at day 8 after they had been into the country if you want to catch the majority of cases. And if you did that, you might have to wait 24, 48 hours for a result. So the earliest, really, that you might even think about releasing someone from quarantine could be 10 or 11 days. And I'm not saying this is what will happen, I'm just giving you an example. So you might shorten somebody's quarantine period by maybe 2 or 3 days. How much difference does that make to that quarantine period for that person, number one, versus how many cases will you miss that way? Because it is likely, and I don't know that anyone can tell me, that we won't miss any cases that way. We could miss some cases. For me, the key is how many. So I think with all of these things, we look very carefully. We don't just dismiss things out of hand. We do want to make things as simple and as straightforward for the population as possible. But we absolutely have to fully understand and weigh up the consequences of anything that we change in terms of the isolation period before we take that action. So precaution is what I would say.
Thanks, Nicola. Alistair Grant from the Herald.
Hi, First Minister. Thanks very much. The Scottish Liberal Democrats have called on the government to publish the science and the review which underpinned the lifting of the quarantine in relation to Spain. I think Willie Rennie has said the government is putting trust at risk if it refuses to publish that advice. Will you publish this information to offer clarity as to how these decisions are being made? And can I also just ask quickly, I think you mentioned earlier the concerns around hospitality outlets following coronavirus guidelines. Do you have any information about the number of outlets, whether pubs, cafes or restaurants, which have been subjected to enforcement action, such as getting shut down by the police, or is this simply anecdotal concerns?
On the latter of those 2 points, what I've described today is anecdotal, and I get lots of emails and contacts with people with concerns, but I hear it in other ways too. So it's anecdotal, and I think it's appropriate to reflect on that and try to act on that. I don't have figures to hand right now about enforcement specifically in hospitality, but we'll look to see whether there's anything we can give you around that. What I would say is I think the majority, possibly the overwhelming majority, are doing the right thing here. But we know, again, because of the nature of what we're dealing with, is that it only takes one pub or restaurant or other place that people are gathering to let its standards slip for an outbreak to happen. And then we are in a race against time to stop that outbreak spreading and becoming much more serious. So let's cut off this virus as much as we possibly can at source. And if we all do that, then we end up in a much stronger position. On the data underpinning the decisions on quarantine, I would like it to be published. The Scottish Government doesn't own this data. It is data that is shared with us that comes from the Joint Biosecurity Centre. It's UK government-owned data. I have given a bit of an insight into it on previous occasions standing here, but the actual data is not ours to publish. We have asked the UK Government to consider publication, and we are continuing to press that point, and I hope we do get into a position where this data can be published, because I do think the fact you'll have seen this with me standing here day in and day out. I think the more of the factors and data and different things underpinning our decisions that we're able to share with the public, the greater understanding of why these decisions have to be taken. And the more understanding you have, I think the more buy-in you can get to them. So we do hope that we can get to a position where this data is published. Andrew Learmonth from the National.
Thank you, First Minister. Good question for the Deputy First Minister. I've spoken to the head teacher of a school where there's a high number of BME students and staff. The head teacher I spoke to has a number of concerns. We know that COVID will have had a disproportionate impact on BME pupils. The Royal College of Paediatrics and Child Health recently said Pakistani, Bangladeshi and black children in particular are more likely to have lost a loved one and are less likely to have had proper access to online learning. Is that something the ERG has considered on pupils? Can you see what the Scottish Government is doing to try and address this disproportionate impact in the school's return? And on teachers, given the higher risk to those communities, will you, as you have asked NHS boards to do, support schools and councils to carry out risk assessments for BAME staff?
Thanks, Andrew. Risk assessments will have to be carried out by all schools into all relevant factors, and of course the issues about the BME community is a very significant part of that risk assessment work, so that will be an element of the planning that schools have got to undertake, and it's important for the assurance of staff, pupils and parents that that is undertaken. In relation to the question of whether these issues have been looked at by the Education Recovery Group, the answer is yes, and they've also been looked at by our expert advisory group who've provided us with scientific advice. What the guidance will set out the various steps that should be taken to make sure that schools are safe in every respect, and that will include the particular measures in relation to the BME community. So these are significant issues that have to be taken seriously at an individual school level, and the guidance recognises that important point.
Can I just add to that and put on my hat as a constituency member of the Scottish Parliament? The constituency I represent in the south side of Glasgow has a very large BME population. Many of the schools in my constituency, the school you're referring to may well be in my constituency, I don't know, have a high proportion of young people from BAME communities. So personally, it's an issue I feel very strongly about, that we need to make sure is in it's factored into all of our considerations. And I know that John is making sure that happens in the wider discussions, but certainly from that constituency interest of mine, I know firsthand from my understanding of that community how important it is. Mark McLaughlin from The Times is the last question today.
Good afternoon, First Minister. The Deputy Chief Medical Officer may want to give her views on this one as well. Last week, Mark Woolhouse told The Times that he felt he had to share some of the blame for the disasters that we saw in care homes because he said he failed to shout loudly enough that COVID was a disease of old age. Recently released minutes from the COVID-19 advisory group, the Scottish Government one, shows that on the 1st of April, he recommended something called enhanced shielding, which is basically you focus all of your resources, the vast majority of your resources, on vulnerable people and their contacts, while the rest of the population can have a reasonably normal life. That included daily PCR tests for vulnerable people and their contacts. Why was that never introduced, and is that something that could be considered for the future?
Nicola may want to comment on that. Can I just say, generally, we consider advice all along the way, and there's lots of opinion put to us, there's sometimes advice put to us, and we come to decisions on the basis of the best possible judgments we can make. I know the comments from Mark Woolhouse that you are referring to as the leader of a government. The buck stops with me and the government in all of the decisions we're taking. And, you know, I've said all along we will have got things wrong in the course of this, and we will possibly continue to get things wrong along the way, although we try to avoid that. But we take these decisions in the best way we can and for the best reasons. And we look to learn from expert opinion where we can. And that applies not exclusively to, but it applies to the decisions we've taken around care homes, and it's applied to the decisions we've taken around shielding more generally. Nicola, do you want to add anything to that?
I think just to say that, of course, all along the way in this pandemic, I know that we have all done our best to protect those that are most vulnerable to this infection. And that, of course, we now know is the elderly. First of all, it takes time for data on risks to come out and be apparent. But I think as well, in certain strategies that we've been asked to look at, for example, like in enhanced shielding or segmentation, in other words, grouping the population into certain nice discrete groups to say if we can just somehow wall them off somewhere and protect them, then everyone else is probably okay. The social science in this just doesn't suggest that that is a viable strategy, and that there is a lot of social mixing that takes place across, for example, multiple different age brackets, which means that it just isn't that simple to do it that way. I think as well that although I wasn't with government at the start of this particular pandemic, things again at that stage, it wasn't clear how long it would be that someone would potentially have to be in enhanced shielding for. And that's a very restrictive, very highly protected, very isolating prospect. So again, there would have been a decision about the balance of risk or harm versus benefit in thinking about that approach in terms of vulnerable elderly people. So in short, in segmenting people by age in general and trying to keep them apart from each other, it generally doesn't work. But secondary, enhanced shielding, really high level shielding, is incredibly isolating, as anyone who has shielded for the last number of months will probably tell you, and it is always a balance of risk.
Thanks, Nicola. That concludes the questions for today. My thanks to John and Nicola for joining me today and assisting with the questions. Thanks to Anna, our BSL interpreter for the day, and to the journalists. And thank you to all of you for tuning in and listening. I hope you still find the information that we're able to give you here useful. Let me just end with the appeal I always make at the end to you to follow the rules of the Facts campaign. If we all do that, then we don't take away all of these risks, but we do help to minimise them. I don't think you have to look too far across the world right now to tell all of us that this risk is still there. It is still real, and we ignore it at our peril. So the ways all of us as individuals can try to mitigate it are simple, not easy to do and not always easy to remember, but basic measures. Face coverings, avoid crowded places, clean your hands on hard surfaces, keep a 2-metre distance, and self-isolate and book a test if you have any of the symptoms of COVID. And if we all do these things, then we hopefully will continue to keep ourselves in the much stronger position that we are in today. So thank you very much for listening and for all of your cooperation. I'll be back here tomorrow at 12:15 for the daily update then, and I hope to see you then. Thank you very much.